All righty. Well, hello everyone. Happy Friday. Hope everybody's having a great day. All right. So I am here to answer questions related to hyperthyroidism and Graves, hypothyroidism and Hashimoto's. So before seeing if anybody has any questions, let me just go through some resources for those who are not familiar with me. I do have a podcast, and it's called Save My Thyroid. And you can check it out by either visiting savemythyroid.com or visiting your favorite podcast platform and typing in Save My Thyroid. And the podcast focuses a little bit more on hyperthyroidism. So most of the content can benefit those with both hyperthyroidism as well as those with hypothyroidism and Hashimoto's. But you'll just because most of the thyroid related podcasts out there focus on hypothyroidism and Hashimoto's, and really none of them focus on hyperthyroidism. So this one doesn't exclusively focus on hyperthyroidism, but again, a little bit more of a focus. And then naturalendocrinesolutions.com. Here I have hundreds of articles and blog posts. Hard to believe it's been 15 years. 2010 is when I launched naturalendocrinesolutions.com. Also have a supplement line, which you can check out by visiting thyroidsave.com. And here are some additional resources. I have a newsletter called Healthy Gut, Healthy Thyroid. That's been out for now about 4 months. You could check that out by visiting savemythyroid.com/newsletter. Have 3 thyroid related books. So natural treatment solutions for hyperthyroidism and Graves' disease. Now it's in its 3rd edition. The 3rd edition was released in fall of 2023. Hashimoto's triggers, excuse me, that was released in in February, I believe, of 2018. And the Hyperthyroid Healing Diet is my most recent book that was released in spring of 2024, so a little over a year ago. And also I'm on YouTube. Just could either search my name on YouTube or visit savemythyroid.com/YouTube or savemythyroid.com/quiz for to take my Save My Thyroid quiz. Also, there's a webinar. I'm conducting a free webinar this weekend. Conventional and natural symptom management options for hyperthyroidism. So if you have Graves' disease or toxic multinodular goiter or another type of hyperthyroid condition, you might want to check that out. It'll be Saturday, May 17th at 1 p.m. Eastern Time. And you can register by visiting savemythyroid.com/hyper webinar, May 2025. And reason I'm doing this, honestly, the webinar, I'm actually presenting the same I'm having the same presentation on Monday to practitioners. And I figured, you know what, I'm going to just get some practice in and share the information with my followers, and also take like 30 minutes or so for questions. If there are questions, we'll see how many people show up on a Saturday. But I was debating either Friday night, or Saturday during the day, just because I really just thought about it yesterday, and I was like, yeah, I think that would be a good idea. So like I said, we'll see how many people register. And that's it. If there are any questions, definitely let me know. Now's the time. If there's no questions, that's perfectly fine as well. But if there's any questions, again, related to Graves' disease, Hashimoto's, non-autoimmune thyroid conditions, you could let me know here. And again, I'm going to leave this up here just in case if anybody trickles in late. Oh, you know what? I forgot to send an email reminder for this. I posted this in the Facebook groups, but usually I send an email reminding people about when I do a Facebook Live, and I forgot to send an email reminder. So that's my bad. But all right, let's see. We do have a question here. Mama Boys, hi, I'm confused. I was diagnosed with Hashimoto's a few years back. My endocrinologist did blood work recently and it showed a TSI of 5.31. She didn't explain I've been in a hyperthyroid state for almost 2 years. Um, and then I've been taking bugleweed, 6 milliliters of Hawaii Farm. So let's go back to this. So, um, yeah, so I mean, TSI, thyroid stimulating immunoglobulins, these are the antibodies associated with Graves' disease. And yeah, I mean, pretty much if you have hyperthyroidism associated with those thyroid stimulating immunoglobulins, then that's diagnostic of Graves' disease. And I mean, a lot of people do have the antibodies for both Hashimoto's and Graves, so it is possible. And I mean, it wouldn't be a shocker for you to have Hashimoto's and then a few years later to develop Graves. So it's yeah, something that I do see, and I see the opposite too, where people are diagnosed with Graves and then kind of switches to hypothyroidism and they have antibodies to Hashimoto's and become diagnosed with Hashimoto's. But with you, it's the yeah. It looks like you have Graves, and then yeah, as far as the bugleweed, 6 milliliters of Hawaii Farm. And is that enough? I know you can't give specifics. It does depend on the person. Like you said, I can't like specifically say this is what you should take. Like so Hawaii Farm, it's a 1-to-3 extract ratio with when I dealt with Graves, I took Mediherb, which is 1-to-2, so it's a little bit more potent. I took a teaspoon, which is 5 milliliters twice per day. Now, not everybody takes that though. It depends if their hyperthyroidism is on the mild side, just like slightly elevated. Maybe I would recommend like 2.5 milliliters or half a teaspoon twice per day. If they were taking Hawaii Farm, like let's say Hawaii Farm, instead of like 5 milliliters twice a day, I might say 7.5 milliliters twice per day. So if they had mild hyperthyroidism, then it would be about half of that. So like, what would that be? Like 3.75 milliliters twice per day is what I would recommend, or approximately that. So, I mean, the truth is, we don't know how anybody's going to respond until we put them on a certain dose. And that's the same with methimazole. We see with anti-thyroid medication all the time. Someone might be put on whatever 10 milligrams, 20 milligrams, and it might be too much or it might be too little. So if you are taking usually I recommend divided doses. So if someone's taking 6 milliliters, I would say like 3 milliliters twice per day. And and then see what the next blood test shows. So yeah, that would be, again, not specific recommendations, but how I would approach a patient in your condition, or in your situation, I should say. As far as which book to buy, to follow, I mean, since you're predominantly Graves with a hyperthyroidism and a TSI, I would say the natural treatment solutions for hyperthyroidism and Graves' disease. I mean, if you want to focus really on the diet and lifestyle first, then you might want to start off though with the hyperthyroid healing diet. I mean, it wouldn't be wrong to like look at Hashimoto's triggers, but if you're choosing between the three books that I have, I would say maybe, again, if you feel comfortable and confident, like for what you've done so far with diet and lifestyle, maybe just go to natural treatment solutions for hyperthyroidism Graves. But if you really need to bear down on the diet and stress management and sleep, um, then I would start with the hyperthyroid healing diet. And you could get my books on Amazon. I mean, that's the easiest place. Just visit Amazon. And I mean, Barnes and Nobles also, like, again, you could go to a different website, but probably most people purchase it on Amazon. Okay, so Viva, hope I'm pronouncing your name correctly. So I have Graves, have had 2 doses of radioactive iodine, which did nothing. Now due to my, oh, okay. You're due to have your thyroid removed. Is it worth delaying the operation, trying natural approaches, and how long should I try it for? I mean, you're going to get a biased opinion from me. I'm going to say yes. I mean, again, I can't tell you what to do. I don't want to say don't get the surgery, and then, I mean, everything's versus risk versus benefits, though. So I will say this: like, what's in most people, it's not, I mean, as long as you're safely managing the symptoms of hyperthyroidism, I again, that's what I do is I help people, and not that I'm the only one, but again, to me, the risk of getting the thyroid gland removed, obviously, you're going to need to be put on thyroid hormone replacement. Not everybody does well with thyroid hormones. There are risks with the surgery. And again, Graves is more of an immune system condition than a thyroid condition. So you're not addressing the cost when removing the thyroid. And the research clearly shows that people with one autoimmune condition have an increased risk of developing other autoimmune conditions in the future. I actually have a podcast episode I just released on this topic. So those are some of the reasons to consider trying a natural approach. And for most people, it'll work. If I mean, it's not always as easy as changing one's diet and lifestyle, but you certainly can start by reading my book, The Hyperthyroid Healing Diet. And for some people, just reading that book alone will lead to dramatic results. But if not, it might mean, and probably will mean, that you would need to dig deeper. Like there are different triggers, and food and stress are certainly common triggers, but then there are other triggers as well. And I talk about that also in my other book, Natural Treatment Solutions for Hyperthyroidism and Graves. So, I mean, yeah. So I would say, again, for most people, I'm going to recommend to take a natural treatment approach. If there's like an emergency situation where they're having like they have like a really enlarged thyroid that's causing obstruction, something like that, like difficulty breathing and swallowing, then again, surgery might be a good idea. But in most cases, like just having Graves' disease itself, again, while scary and comes with a lot of symptoms, and there are risks with the medication too, but again, I also there are natural approaches, which is what my webinar tomorrow is about, and which I've spoken about also elsewhere and even in the book. So, or natural treatment solutions for hyperthyroidism and Graves. I talk about like the bugleweed and motherwort. Don't really talk much about that in the hyperthyroid healing diet, because really the goal is really just to focus on diet and lifestyle with that book. But yeah, either way. So like I said, you're going to get a biased opinion when it comes to, with me. I'm going to give a biased opinion. But again, I've been working with people with Graves and other types of hyperthyroid conditions for over 15 years. And, just, I mean, which is great, but it's also sad that there are so many others who have gotten the surgery, received radioactive iodine, who could have saved their thyroid if they did give it a chance. And most people, when they take a natural treatment approach, they don't regret it. Obviously, if they restore their health, they definitely don't regret it. But a lot of times, or I mean, just if someone, I mean, not even like in the groups, like if you visit like the Facebook groups, people who haven't worked with me, and again, who you work with could make a difference, like experience wise. But I guess the point is, for those, even when you see someone who took a natural treatment approach and they didn't get the results that they desired. Um, and again, when you work with someone, I'm not saying it's easy, but like when you work with someone with experience, again, there's a really good chance of being able to get into remission and restore your health. But again, what I'm trying to say, there's rarely regret, like, because again, if the regret comes when someone hasn't tried a natural approach and they get surgery and or radioactive iodine, or at least with some people. Obviously, there's some people that get the surgery, they're perfectly happy with their decision, but sounds like you're kind of unsure. And as far as how long should you try for, I mean, it's everybody's different, but if you're gonna go for it, I would say like at least like 6 to 9 months. Like this is not like a 2 to 3 months that I'm gonna try it and see if it restores my health. I mean, hopefully within like 3 months you start seeing things heading in the right direction. Again, assuming you're doing the right things, but um, ideally you want to work with someone. But if you can't afford to work with someone, then again, read my books, take advantage of the the podcast, the free information on the podcast. Maybe check out the webinar tomorrow, which is free. But yeah, 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 and you regret the radioactive iodine and it put you into menopause. Yeah, I'm sorry. Yeah, and again, surgery. I mean, if you do choose surgery, obviously you want to make sure that you choose a experienced surgeon, one that has done at least hundreds of surgeries, um, of the thyroid surgery specifically, just because complications do happen. It's not most people don't have complications, but it's not like it's super rare either. So yeah, again, like I said, I'm always going to take that biased approach. Um, and then Mama Boy says, "Thank you. Is there a cutoff for the bugle weed? How much should I not take?" I mean, I usually with the Mediherb, usually it would be like 5 milliliters 3 times a day, so like 15 milliliters. With the Hawaii Farm, you might be able to go a little bit more than that, like 20 milliliters, just because it's not as potent. But yeah, that to me, that's at least that's the cutoff I have with patients. And yeah, I didn't recommend. I was hypothyroid, was on levothyroxine for 15 years before I went to hyperthyroid. Yeah, I mean it does. It's again, I've had people where they were dealing with Hashimoto's for a long time, like you. They were on thyroid hormone replacement, and then all of a sudden became hyper, and they thought, well, maybe we just need to adjust the medication. Maybe it's just that for whatever reason they're taking too much thyroid hormone, and then after some testing, they realized that wasn't the case. That they switched from hypo to hyper, and so yeah, it sounds like it was the case with you. And yeah, yeah, I'm sorry also what happened to Wolviva as far as putting it into menopause. But again, the good news, you still have your thyroid, so there is still a chance to save it. So I'm gonna encourage you to try to do that. And yeah, I'm glad you attended this call here. So hopefully my encouragements will at least lead you to look into it, to maybe if you haven't already, to read some of my books, or again, even just listening to the podcast. There's a lot of information on the podcast. Just the book obviously is pretty comprehensive, but all my books, and just again, just more like with the podcast, definitely a lot of information. You just kind of have to jump around to get that information. And there are audio versions for both of my hyperthyroid books. For the Hashimoto's triggers, there's no audio version of that. Um, okay, well, Viva, you are very welcome. Thank you for your questions. And I do have nodules. Would those cause my hyperthyroidism? I mean, they could, but I mean, in some cases, people have what's called toxic multinodule goiter. So they have toxic nodules that cause hyperthyroidism. Now, with you, you said you had the positive TSI, thyroid stimulating immunoglobulin. So, I mean, is it possible to have Graves, the antibodies for Graves, and toxic nodules? Yeah, it's possible. It's just not too common. So yeah, chances are it's probably just the Graves, but I mean, I don't know if you had an ultrasound. I mean, sometimes they'll do like an uptake test, which I'm not a huge fan of the uptake test, but sometimes that they'll do that to see if someone has like hyperfunctioning nodules. But most of the time, that's not the case. I mean, if someone had negative thyroid stimulating immunoglobulins and hyperthyroidism, and they had an ultrasound done that showed nodules, which you do, and a goiter, then maybe that would be justification to do an uptake test to see if since it's not probably not related to Graves, that maybe it's related to the hyperfunctioning nodules. But in your case, since you have the positive TSI, it's almost definitely related to the Graves. All right. Any other questions? Yeah, again, I just realized when I started this, I'm like, I forgot I usually send out a reminder email, because this is going out to my Facebook page and YouTube channel, and on I did post it in the groups, like a alert in the groups. But the problem with the groups, even though I have like tens of thousands of people in my groups, I have two thyroid related groups, only maybe a few hundred will get that notice. And so usually I also send an email to yeah, to my list about an hour before. And like I said, I completely forgot to do that. So, all right. Thank you. That helps me understand a little bit more. You are welcome. All right. Any other questions? And for those who trickled in late, tomorrow on Saturday, I'm hosting a webinar talking about conventional natural symptom management options for hyperthyroidism. We spoke a little bit about it here with the bugleweed. So with that, but there'll be an official presentation tomorrow. A little bit more of an emphasis on the natural symptom management options, of course, and yeah, doing it tomorrow, May 17th at 1 p.m. And as I mentioned earlier, I'm doing this just because on Monday morning, I have a presentation that I'm doing to healthcare practitioners talking about symptom management and hyperthyroidism. And it's a functional medicine practitioner. So they're also more interested in the natural symptom management options. So I figured, you know what? I just thought about this yesterday. I'm like, you know what? Well, this is a good opportunity. Why don't I just have a separate webinar to my followers, and this way it'll give me practice to go over the information, and then also to answer questions. So that's going to be on Zoom, and yeah. So anyway, if you are able to attend, great. If not, no worries. But savemythyroid.com/hyper webinar May 2025 is where you could register. And if there are no other questions, I'll call it a day. Again, usually there's more questions, but like I said, I didn't send out the email, so that's my fault. Mama Boys, I only have YouTube as my social media, or else I would follow you everywhere. Oh, I understand. Yeah, not everybody's on it, and tomorrow it's not going to be on social media. Tomorrow's it's going to be on Zoom, which is just an app. Um, but yeah, no, I appreciate you following me on YouTube. So yeah, no, that's yeah, I actually got a warning on with YouTube. Speaking of YouTube, I got my first ever warning. I've been on YouTube now for, I think, since 2009, since I started this at 2010. And we just released a week ago an episode on the podcast that's also on YouTube about breast thermography. And they red flagged it. They gave me a warning. They took it down. They removed it, and and again, it wasn't saying like to do thermography and not to do mammograms. It was just like bringing up an alternative to mammograms. And but they took it down and gave me a warning that if I violate their terms again, they're gonna like freeze my account or something. So hopefully that doesn't happen. But I'm gonna fight them on this though, because I can't. They gave me an option to like to message them back and dispute it, which I am going to do. I just found about out. I just got the notice today, and just haven't had a chance to dispute it. But yeah. So YouTube, I've been on for a long time, and was a little bit upset about that. But yeah, it's yeah. I just again, I mean, I don't. I mean, it's bad enough when I interview someone and they won't. I mean, at least if they're on the podcast, so they'll have that exposure. But I hate to get banned from YouTube when I'm not. It's not like I'm spreading misinformation. I mean, thermography has been around for a long time, and it is another option. And like I said, it's not like we had a conversation to do this instead of mammogram. So, um, yeah, anyway, we'll see. Maybe I'll win the dispute. But not, I guess, just have to be careful. And that's the thing about any social media, even with Facebook. I'm always at risk of getting booted out off of Facebook just because, like I maybe not something that I say, because I try not to be too controversial, but then sometimes they'll give warnings to the group because someone in the group says something that they shouldn't be saying, which I can't control, but that's the way it is. So yes, I'm going to be 42, and they harass me for mammograms. Yeah. Yeah. It's again, I'm not yeah, I've had one done. Yeah, I'm not saying there's not a time and place for them too. I just not a big fan of the annual mammograms like every year. I know again, yeah, there's the argument, well, don't they save lives? And I'm not saying they can't, but again, it's risk versus benefits. And like And I had Jen Simmons, who's a medical doctor, on the podcast about a year ago. Should be on YouTube as well. But so she was talking about a different method that's coming out, or maybe already out. Um, that's another like alternative as well. And again, this is coming from a medical doctor, not it's so yeah. Anyway, but that's the way social media is. You just never know what might rub him the wrong way. So, but all right. So since there's no other questions, I am going to call it a day. But hopefully I'll see some people on the webinar tomorrow. But otherwise, have a great rest of your Friday. Wonderful weekend ahead, and I'll catch you either tomorrow or on a future live call. I was going to say Facebook Live, but again, it's streaming to YouTube as well. So, so a future Q&A live call. Thanks, Wolviva. Look forward to seeing you tomorrow. Again, have a great rest of your day, everybody. Take care.